Dr. Joe Cangas, welcome to the show. I'm glad to have you here today.
Thanks so much for having me. I appreciate it.
Yeah. So, Joe, you're a pediatrician?
I am.
A pediatrician who's always had a private practice?
Almost always.
I
had 2 years of practice in Salem, Illinois before I decided I was ready to go out on my own. So.
2 years is not very long time for a young doctor.
I didn't really know that I was ready, but I came across Columbia, Illinois, didn't have a pediatrician in the county, and I was just like, I think I might want to do this. I actually reached out to hospitals trying to get them to put me there, talked to the family practice group that was in town, and they felt a little too proud, I think, that they saw kids. They didn't need a pediatrician. Now, step forward, they did call me about a year after I opened and asked me if I wanted to come work with them and what it would take to come work with them. But by then, I was growing a great practice, and I was just like, more money, less hours. If you can give me that, then I'm all out. I'm in for it. But yeah, and I actually... the hospitals at that time was, it was 2006, and there was litigation was huge in Illinois at that time. And I think a lot of hospitals, a lot of people in general just were not getting out of Illinois in practice as opposed to moving into Illinois. So they're like, not right now. Now they're doing it again now. But
I remember that scuttlebutt. I was a brand new baby PT in 2005 and working in Madison County, Illinois. I remember all the talk about the liability. Sure. Yeah, I remember that. But if we can back up a minute, I really like the audience to know where you did your training and how many years you were here, there, and everywhere to become a physician.
Right. So out of high school, I joined the Army. That was more of a just time to grow up. I didn't really feel like I was ready for college, actually. I went to community college for 2 weeks, and I went to class twice and decided that it was not a good idea. I knew I wanted to be a doctor. I known that since 8th grade. I didn't really know much about medicine other than my family doctor. So anyway, joined the Army and ended up in counterintelligence and loved the Army. Wow. But as I was doing my training and did a language school and things seemed to really be clicking, I'm like, I should probably get back to school.
You should get back to school. Platypus. Hold on one second. We are doing some, hey Sarah, I'm just going to be recording back here, just so you know. Okay, it's no big deal. I know. Good. Glad. I just thought I should let you know. Good to see you. Sorry, I hadn't.
No, that's no problem.
Okay. Let's start back. You were talking about being in the Army. Okay, so you were in the service and you're a physician, and those are two aspects of life that I feel like the average person doesn't have much perspective in, but that's not what we're here to talk about today. Right. It'll have to be a different episode.
Right, absolutely. Yeah. But I loved the Army, and like I said, I just really thought it was time to get back to college, and so I came back home and went to Western Illinois for my undergrad. I went to University of Illinois for my medical school, and that was in Champaign and then Peoria for 3 years, and then ended up at Mizzou for my pediatric training. And that's kind of how I came to the St. Louis area. I came over from Mizzou and just kind of fell in love with St. Louis and decided that's where I wanted to be in the future, close enough to my hometown, about 3 hours away, but near reality, as I always like to call it. So.
Yes, because you said you were in a very small town in Illinois for a little bit.
Yes, yeah. I grew up in a town of about 1,000 people. Wow. And then that job in Salem I had the first 2 years is around, 10, 12,000 people, I think, something like that. So,
wow. So you started working as a physician. You said you did a couple years working for someone, and then you took the leap into private practice.
Yes.
Which is that's my goal. I want more of us to go to private practice. So what drew you to that arena?
Some of it was just timing. Like I said, I found Columbia, Illinois. There wasn't a pediatrician in the county. Didn't have an opportunity for employment there. Wanted to be close to the city. And as I saw the community as one that was growing with insurance and people who could afford to pay their doctor's bills, very important when starting a business, I decided that, I just needed to figure it out. My mom owned a resale clothing store for most of my life. And so I knew the business, the highs and the lows of owning a business from some point. I didn't know how to run a business by any means, but decided to open the doors. And I was lucky enough to be put in contact with a CPA who worked with Glennon starting practices. So we kind of had a binder, is all that it was, with kind of a workflow of things that needed to be done when they needed to be done by in order to open the doors. So
before I started my private practice, getting a CPA was like one of the first things on my list of things to do.
Yes, that's what I advise. It's definitely high on the list of first things I get when I talk to doctors about starting practices as well. So it was an amazing practice for 10 years. It grew quickly because I got active in the community. I think it's always a very important thing. I moved to Columbia. I was part of Kiwanis, part of Rotary. I went to PTA meetings. I was active in chambers and all kinds of things, and just really was out in the community. Started a nonprofit when I was in Salem, which gives bicycle helmets to kids, partners with police to give those helmets out, partners with police to give rewards to kids seen wearing helmets.
Excellent.
And while I didn't start as a marketing tool, it really became a great asset in marketing my practice.
Yeah.
I was at every event in the public, and I wasn't there, asking for business. I was just giving bicycle helmets away. And it was a great way to meet a lot of families and a great way to see that, for them to see that I was there and that I wasn't just out to make a buck.
What a great service too. So Helmets First was your nonprofit, and as a physical therapist and as a mother, I can tell you that I have had to be really adamant with my children about wearing their helmet.
Sure.
And if I catch them not wearing their helmet, then their bikes are gone, right?
Perfect.
Yes. And then, again, this could be a whole nother episode, the new laws that just came out in Illinois regarding e-bikes.
Oh, I didn't know those existed, so I hadn't heard about those.
Oh, well, I'm very familiar with it because of an e-bike incident that happened with my child last year, but that's okay. Like I said, a whole nother
episode.
But the child was not doing what he was supposed to be doing, but he had his helmet on.
Okay.
So, I feel like I won.
There's a win.
There was a win. So, yeah, well, what a great service to the community. I'm so, so grateful. In fact, one of my children, I think, both my children received some of your helmets a couple years ago at the Criterion race here in Edwardsville.
Well, great.
I didn't realize that was you. So, yeah, thank you. I just remember thinking, what a great service. I think, at the time, too, I was a single mom. So, that was a valuable service to me. So, thank you.
I love it. It's great fun. Like you said, it does some good, I hope. And then, like I said, I didn't expect it to be a marketing tool, but it became a great marketing tool for my practice. Yeah. And so practice grew great, grew quickly. I mean, I think in 6 months, I was at least breaking even, if not making money.
Wow.
A year in, I was making reasonable pediatrician salary. And so I couldn't complain at all. And then about 10 years in, insurance reimbursement started to go down.
So what year was that? 2016?
That would have been it might have been a little earlier than that, 2014, 2015, I think. I saw the numbers just getting closer and closer together,
right?
And getting harder and harder to take home a paycheck. Started putting my retirement back in, started looking at ways I could save money, cutting costs on space size, on employees, got to where I was bare boned, where if one employee was gone, we could barely function, but I couldn't afford to pay more. I was probably paying myself out of my retirement to stay active.
And this is all because of the reimbursement rates that insurance companies were willing to pay physicians. And here you are, a physician, barely able to put food on the table because these insurance companies are trying to make so much money.
In a business where they decide what they pay you and they decide when they pay you.
Wow.
I mean, honestly, we'll get to the point I talk about my current situation, but I closed my offices, all my brick and mortars in 22, and I still get checks. So that tells you how, I'm glad to have those checks, but again, at 4 years later, 3.5 years later, why is it that it's okay to pay me that late, let alone pay me what they want to pay me? That's a whole other conversation probably as well.
We can talk for hours about the problems with the insurance company, but I just want to mention, I have a private practice that I opened in 2020, but I never, ever even attempted to get contracts with insurance because it's just me.
Right.
I'm a physical therapist. If I don't get paid, if I didn't get paid when I did services, I wouldn't be able to keep my doors open. And I've caught a lot of flack from some people about this aspect of my practice. And I agree. I know, I have ways that I have created in my practice to offer services to people who cannot pay me cash up front for what I do. And I have a nonprofit on the horizon also for that as well. But, it's just not, as someone who is passionate about providing good care, and I will not let someone dictate what I can or cannot do, especially when that person does not have the education that I have. I am a strong, bullheaded Aries woman. I'm going to do it my way. And I have found a way to do it. Now, I think as a physician, I don't know that there's a model for physicians to get paid cash up front, or tell me about.
Yeah, so I'd been part of Facebook groups for a number of years. I would say back in even maybe 15, 16, I saw some docs who were doing what's now called DPC, direct primary care, to where they do some do fee for service, to where you pay for each visit. I feel like that's still a lot like standard medicine, to where you have to see people to get paid. And so then you make people come in, maybe when you could do something over the phone, over a text or an email, because you need to get paid.
Right.
I love the membership model, as it's called. And I do that now, where it's a monthly subscription. And then my patients have direct access to me. And the model I have, I'm more of a concierge, which is more higher, and my prices are higher, but it's all house calls. And it's all direct access to me. So those patients who pay my full price, I do have a couple of tiers now, but those that pay the full price get access to me 7 days a week with house calls 7 days a week. And those who pay the lower price just standard doctor's hours, Monday through Friday, 9 to 5. They can call me directly. But I do have a nurse line outside of hours. So it's not like they just don't have any access outside of those hours. They just don't have access directly to me.
Wow,
I'm still on call for that nurse line. So if they need me, but something more complicated or a family just isn't happy with that answer, then they can reach out to me and have me call that family back. So
you're making house calls.
All house calls. So
I think that's fabulous.
I love it. There are so many things. Just talking about looking at kids' growth is one thing, but you can do that in the office. You can get their vitals, you can do their exam. Sometimes not easily. They're fighting more in the office than at home, even too. But I've had a child, for instance, a mom had said at 2 years old, the child had no words. And 45 minutes later, as we're just having a conversation, the child's over playing with his toys. He picked up a cow and he said moo, and a pig and he said oink. And I was like, oh, well, those are words.
Yes.
They're just not the words you want him to say. You want him to say hi and bye and whatever. So it did change my perspective and it changed my plan greatly. So that family then wasn't going to 3 specialists, using their insurance for that, taking time off work to get them there, traveling they live down probably half hour south of the city. So traveling into the city for specialists and therapy and things like that, and for hearing tests. We just did some speech therapy. They were able to find someone to do that in home as well.
Yeah.
And so we just waited to see how things went before we could have still maybe needed those other specialties, but we didn't.
Yeah.
Within a few months, he was blossomed and he was doing great. So
what a great story.
If it had been an exam room, first of all, probably wouldn't have gotten past 20 minutes because kids got to get out of that room.
Yeah.
And I tried to do an office version, and that's one of the reasons I stuck with the house calls. But also, like, they wouldn't play with toys. There's just so many things.
They wouldn't have been comfortable in their
so
environment.
many times they ask about how they're walking, but then you go to put them down in the exam room floor to walk, and they're picking their legs up, or they just take off running, and I still can't see. So there's so many things in the house call that I can see that I would never see in an exam room. So
about half my career has been spent in home care, and it is a whole nother beast. There are a whole other, you don't have control over your environment.
Right.
And some, especially PTs, tend to be type A. Some PTs can't handle that, but I kind of liked it. I saw it as a challenge. I had to meet these people where they're at. I enjoyed working with people in their home. Now, I was never a pediatric therapist, but still, just being in the home is a whole new realm. So that's what that's how your practice is.
That's how I practice now.
Yeah. And listen, a shared interest that you and I have is trying to get more clinicians to go into private practice. Can you talk a little bit about your endeavor right now?
I'm actually working on a book on helping doctors start a practice. Now it's based on the cash model, the direct primary care model, because I really don't think a doc should go into an insurance-based model at this point.
Right.
I have doctors who come out to me because I also do real estate. We can talk about that at some point, but I help doctors find their office space.
Yeah.
So they come to me looking for that information. And then I also let them know I'll share any experiences I can, not being a true consultant for them on that part. But when they tell me they want to start an insurance practice, I always ask them why, but they can see the reimbursement they get in the hospital. And I let them know, as a solo doctor with no negotiating power, you just take what they give you. And that's all you can do. You have no negotiating power. Even when I had 7,000 patients, I had no negotiating power. When I had 4 locations and I had all these patients, there's just nothing I could do to negotiate a contract. So working on that book, and then developing some platforms like my GROW framework, which is just an acronym for get involved, referral partners, online presence, and wow your patients. So about that patient experience, ways to grow the practice, and social media posts. And then the book is part of that as well. And then I really want to do consulting to help doctors start that practice and really help them take off running from the beginning and feel comfortable about that, because so many do it on their own. And they might be in a Facebook group and ask some questions, but they're still all alone doing it. So really help them kind of hold their hand through that as much as they want.
Yeah.
I kind of did that with the accountant that I had. I called him probably every couple of weeks. We ran through the list to make sure I was on track. Just I had a second set of eyes making sure I wasn't missing something.
Yeah. You got to have those professionals to back you up. But it sounds like, what you're taking away barriers from other people going into private practice. And listen, I'm also passionate about more of us providers, healthcare providers, going into private practice. My little slogan is, let's put the care back in healthcare.
Nice.
Because,
love it.
Right. Thank you. Because, when you're working for someone else, when the insurance is paying you, you have a manager or a director or someone telling you how many visits to have, how many units to charge.
Right.
To me, I couldn't do it. I cannot work in that system that just is, it seems like idiocracy.
Oh man, it's hard to watch, hard to see. I mean, I have doctor friends who went into residency. Well, when I went to pediatrics, we all had the same grades, and one's a neurosurgeon, one's a radiologist, one's an orthopedic surgeon. They all basically have to have hospital jobs. Some of those do private stuff, but for the most part, they're all hospital jobs, and they hate their lives. They make great money, but then that's kind of one of the parts of the book is kind of like creating what you want. making the practice you want for your lifestyle, the lifestyle you want, not what someone else tells you is the best thing to do.
Right.
There are consultants out there that, one size fits all. Your practice has to be this way or it's not going to work. But that's not true. I'm a prime example of that. No one would ever think people would pay what some people pay me to be their doctor, and other people ask me how I do that, and that's a whole nother conversation as well.
Yep.
But really, it should be what you want it to be, and then working backwards from that and creating a practice that it gives the kind of care you want to give, gives you the lifestyle you want to give, and you work the numbers out to make that work. And you can do that with the right help in the right direction.
Right. So, as I said before we started recording, I would like to tell you a little bit more about my my business, because I can see what you're doing and what I'm doing.
Awesome.
When we partner together, man, we're going to help people take back their lives. Amazing. So I want to talk a little bit about Thrive Everywhere. So Thrive Everywhere is a vision I've had for a couple of years, been working on this for a while. I had an innovation coaching session with my dear college friend, Brandon Rashan of Notorious 111. That's his branding business, and he's been mentoring me ever since. So he and I sat down and he said, well, what do you want to do? Well, I want to help people. He goes, Kate, that's bullshit. Everybody wants to help people. What do you really want to do? And he went into automatic coach mode with me. And it came down to, I want to take a chunk out of the insurance company. I want to show the world that insurance does not have to dictate healthcare. Okay, so how are we going to do this? And that's where we came up with my online platform, Thrive Everywhere. So I guess the biggest piece there's several pieces to this, but the biggest piece that I am most excited about is the nationwide online directory for only private practice clinicians. And we are coded for, I think, 11 different clinicians right now, including physicians.
Awesome.
Yes. So I want to shine a light on private practice, because I don't think the average person realizes how corporate healthcare is. Healthcare is the most corporate of all corporate entities, in my opinion.
Right.
Just taking advantage of the little peons. And the peons are the doctors and the clinicians working in that system. They are just making money off of us. Anyways, we've talked about that for a long time.
Right.
Anyway, so I want to shine a spotlight on the private practice clinicians who have taken the leap that you and I took. It's a leap, and it's an investment, and it is a risk. But we're putting it on the line because we care so much about the care we provide. We got to do it our way. We can't do it that corporate way. So the directory is a nationwide online platform just for private practice clinicians, and we are just about to start onboarding clinicians. Now, what I am super stoked about is my patent. My patent is on the search filters.
Okay.
And so the average person can come to this site and search for their clinician based on their symptoms, or if they have a diagnosis, or if they know that there's a specialty service that they're looking for. I did this because what I've learned in healthcare over 20 years is the average person doesn't really know who can help them. It's very confusing. And from my perspective as a PT, when I started 20 years ago, patients had to have a referral from a physician before they could receive my services. And that was how it was for a long time. And I think a lot of people think that's still true, but I have direct access. People can come directly to me because I have a doctorate degree now. I know the difference between physical practice and medical practice. Now, I don't know how to practice medicine,
right?
But I know what I can help and what I cannot help. And I know when I have to send someone to the physician. Anyways, so this platform has some educational pieces to it. I want to educate the public on how to better utilize their health insurance. I think health insurance is so confusing. Even I've been in the industry 20 years and it still trips me up sometimes.
Sure. What's
in network, out of network, deductible, premium, what do all those words mean? So we're going to have an educational piece for that. We are offering a product that is an affordable alternative to health insurance. It's called a Health Share. Impact Health Share is the product that we're going to be educating people on. And really, that the big piece of going into private practice can be that you're so used to having your job tied to your health insurance. And this is a way for clinicians to have affordable healthcare coverage. We also have a podcast called The Healing Journey, where each episode we're trying to tackle issues that people probably have every day, but also giving some opportunity for people to learn how they can take care of themselves or heal, or different avenues of healing, because there's so many different ways we can take care of ourselves these days. So
amazing.
Thank you.
I love it.
Yes. Well, I could
wait for it all.
Thank you. Yes. I could see us partnering and having you maybe being the coach for my physicians that are trying to start their private practice, because I know how to start a private practice, but that's niche. So I know how to run a private practice for an allied health professional, but there are some intricate details to being a physician trying to start a private practice. So can you think about different ways that you can help someone with that?
I think that there's a lot of similarities as well. And I think that the growth stuff that we talked about is going to be huge. Differences are definitely if they're going to talk about doing an insurance base. I could help them with that. I've done that. I know all about credentialing. I know all about the highs and lows of that and the ways to get around and get into the system and the ways to track it. But I think that, again, I'm going to lead more towards the direct primary care, talking about membership models, talking about fee for service, the differences there. And I think getting back to similarities, it's going to be fee schedules and things like that are going to be things that are going to be based around not just around what you think it's worth sometimes. I think what your lifestyle you want, because there are people out there that will pay and want services differently than others. So,
So if someone's seeing you for your concierge level services, or not just you, but any physician, I think one of the questions I had was, okay, if I have this concierge level care, do I still need health insurance? And I think the answer is yes.
Yes, you need something. I mean, there are times a lot of my patients use their insurance for their labs. I do have a great discount offer that I can give them, but they still want to use their insurance, definitely for medications, for vaccines, for definitely if they need to go to a specialist, if there's any catastrophic, if there's any accidents or emergencies, or God forbid, cancers, things like that, you want to have an insurance plan. Or, as you stated, medical sharing plan. I've been on one for many years. And when the marketplace got us to, $1,200 a month with a $6,500, $7,500 deductible, we were still paying for everything out of pocket. We switched to a sharing plan and went down to about $250 at that time now. I think we're up to $450 at this point as I've gotten older and the kids have gotten older, but it's still so much less. And even with a higher deductible, even though it's not a deductible with a sharing plan, in a year with 2 surgeries, we ended up paying less out of pocket than we would have our premiums the years before. Because we met that max and then things were paid for. So anyway, maybe another conversation.
Words being thrown around here, and it can get so convoluted and so confusing. But, in my mind, okay, if I have a concierge level primary care physician, well, maybe I just need catastrophic health insurance, right? So you can balance out where you're paying your dollars. And I would hands down rather put my money directly in the pocket of the person giving me care.
Amen to that.
Cheers. Cheers to that.
And on that note, you talked about how for physicians, it's, it can keep some physicians from leaving jobs thinking they have to have insurance. I've known plenty of my friends who stay at a job because they're worried about benefits. And so, again, a sharing plan is a great opportunity for them to get coverage as well.
Well, I think that's an important point to bring up because, like I said, some people have kind of given me some blowback about my rates and what I charge. But when you're running a private practice, you got to keep the lights on. You got to be able to take time off. You have to go to continuing ed classes. You know, there's a lot of cost to maintaining a professional licensure.
And then in my spot, prices being pretty high, really high in some aspects. The time I spend in a car, the time to be available, I have to have a limited number of patients. So even with only 66 patients, when I have 10 of them sick at the same time, which happens during cold and flu season, a few house calls a day takes my whole day just to get them seen, or just returning the phone calls and texts to get moms taken care of. So that price point has to be there for me if I'm going to practice this way. Again, I could do other things. I could see more patients. I could have an office maybe and see more patients, but this is really how I love to practice. And I think it's best for me and the families. And so I just keep doing it this way and it seems to work. And I think my families really appreciate that, even just access to text. They just text me a question, I text them back, they're thanking me, and I'm like, I did that from, I jokingly say the golf course. I hardly ever golf, but I could, like if I really wanted to, if I had, even when I do golf, I tell my friends like, hey, I could have to go do a house call, so I might be leaving early. But it's
when I'm onboarding new clients, before they leave for their first visit, I say, now listen, I want you to text me anytime. If you have a question or concern, text me anytime. If I don't want to be disturbed, I put it on do not disturb usually, but I want them to have a connection with me, and that is a part of the value. And I even tell them, like, if you think you might have a medical thing, like, let me know, and then I'll let you know if you need to go spend the time, waiting online, waiting on hold, trying to get in, whether you need to go to the emergency room or not. I have opinions. And I like to give those because they can't have direct access to their physician, usually.
Right.
That's what most people
We're going to change that, right?
Yes,
we're going to help doctors get out there and do this thing and be able to help patients. And like you said, that you look at insurance, there's a lot of words to throw around, deductibles and all of that. But when you go to your doctor, you might pay a copay and then you get a bill later. And by the time you've paid that, is your insurance really doing anything for you?
I'm going to say
there's some great plans out there that maybe some people don't. But for the most part, for most of us, we end up paying for most of that out of pocket.
Yeah.
Maybe not the annual checkup. But then we go to the doctor for a sick visit. It goes towards our deductible and we're paying for it out of pocket, just under the time of service, maybe.
I think that, if you aren't in the industry, it's so hard to sort through what plan is going to work for you. And it gets overwhelming. And I think people say, okay, I have insurance. Oh, you do, but do you? And even though I'm in the industry a couple of years ago, one of my marketplace plans didn't cover my mammogram. And I was so mad about that. I was mad for a couple of different reasons. I was mad that I did not take the responsibility to learn that before I got the plan, which it takes energy and effort, right? I was just coming into private practice. That was the first, I chose the cheapest plan, of course.
Of course.
Yeah. I was mad that the hospital, I used to work for this hospital. I know that they have an insurance verifier. Why didn't someone tell me that before I got the service? Because in this instance, I actually think had I known, I think I would have chosen to do a thermography scan, which would have been out of pocket, but would have been cheaper than the mammogram. And the thermography is just as effective at finding things and detecting as a mammogram. So, had I had all the information about my insurance coverage, which let me just say, it was probably available to me. I just didn't take the time to dig deep and learn about it. So I think that when we're buying these insurance plans, it's real easy to get caught in the trap of looking at the bottom line. But you got to dig a little deeper.
So much to them that it's hard not to just do that.
So when I started selling Impact Health Share, I read the guidelines. I read every nitty gritty little detail. And I may not have them all memorized, but I know when a client's signing up, if they have questions about pre-existing conditions and does this rule them out, I am very familiar with what will be covered or will not be covered. And I learned my lesson. So I'm going to try to help people along the way, even if they decide not. I want to make sure people are making the right choice.
Absolutely.
And that's ultimately the most important thing.
Yeah. And on that note on Impact Health Share, I'm a great advocate. I looked into it as well. So I know that it's a great product. And so I recommend that anyone who's thinking about it, reach out to you and find out more about it for sure. So you have my plug there.
I appreciate that. That was my first Keeping It Local episode was on Impact Health Share, actually. So, well, listen, Dr. Joe, if people listening want to get in touch with you or if they're interested in learning more about their practice, how could they do that?
Easiest place to go is drjoepediatrics.com. It's drjoepediatrics.com.
We'll put it in the show notes.
I was going to say easily. I'm on Facebook as well, LinkedIn.
Dr. Joe Cangas, Congas.
It is pronounced Cangas, but it is Cangas.
Cangas. So awesome. We'll put all that information in the show notes. And I know you're writing this book. Do you have a deadline or an idea of when people might be able to get their hands on your product?
I really hope to have it finished in the next 2 or 3 months.
Wow. Okay.
It's been a journey, but we're getting close, I think.
Yeah, and if you ever want to meet my friend Sarah Bland, who's a creative writing
I might have
workshop,
to do that.
She's right out there. We can go talk to her when we're done recording today. So she's helped me a lot with some of my projects that I have doing in the background.
That sounds great.
Well, Dr. Joe, I loved this conversation, learning a little bit about your practice and about the differences between private pediatric practice and the excellent level of care that you're giving your clients. Thank you so much for the work you do, and thank you for your time.
Thanks so much for having me.